The following segment is presented by Bremo Pharmacy.
Vitamin deficiencies can cause some serious health problems, but what we eat may not be the only problem. Our diets are important to make sure we're getting what we need, but medications can also cause some problems with vitamin deficiencies. Ann Anderson is here from Bremo Pharmacy, and first of all, let's talk about what vitamin deficiencies are and some of the problems they can cause.
Vitamin deficiency or nutrient deficiency is when our body is depleted of the necessary nutrients or substances that it needs to function properly and to have energy and just to feel good.
Now, so many of us do take regular medications on a daily basis, and some of these medications are causing those very vitamin deficiencies we were just talking about. What are some of the common medications we need to look for?
Drugs that are used to treat cholesterol, such as statins, can cause a nutrient depletion. Drugs used to treat acid or reflux can cause nutrient depletion. Diuretics or fluid pills can cause your body to be depleted. Antibiotics can cause a depletion of nutrients as well.
Antibiotics for sure. We've all spent the whole winter probably taking those, taking care of infections. What sort of nutrients are depleted and vitamins are depleted from our systems when we're taking antibiotics?
Well, the gut's made up of a balance of good and bad bacteria.
Right.
Bacteria keeps your gut moving like it should and helps to digest food. And when you take antibiotics, it can upset that balance, which leads to yeast infections that women are acquainted with, and also diarrhea that can happen to anyone when they're taking an antibiotic.
What are some of the things we can do while we're taking antibiotics to kind of restore that balance in our system?
Eating yogurt is one thing that you can do to help restore that, but also taking a probiotic can help restore the balance of the good and the bad bacteria that's in your gut.
Now, the Bremo pharmacists they're experts on knowing what medications can cause some deficiencies, and I'm really excited because there's actually a free screening coming up for this entire month to see whether or not your medications are causing vitamin or nutrient depletion.
Absolutely, and it's important to talk to people. With an antibiotic, if you get diarrhea, you know what it's due to. But if you're on some of these longer term medications, statins for cholesterol or proton pump inhibitors for acid, you may not realize that the muscle weakness and pain that you've been experiencing may be due to that medication, because you may have been on that medication for months.
Right.
And it's a gradual onset. So it's important to talk to the pharmacist at Bremo, let them look at all your medications, talk about some of the side effects or symptoms that you're experiencing, because it very well could be due to the medication you're taking and not a new disease state or a new problem, or aging. Some people just think it's aging, and it's not.
Yes, so that's why you really want to rely on the experts at Bremo Pharmacy. The screening is free through the month of May. We hope you'll take advantage of that. Just go by the Staples Mill Road location for Bremo Pharmacy. Get all the details at bremorx.com.